I'm a big proponent of genetic testing, and I have kind of come up in an era where, when we started, we had one gene we could assess for. We could assess for SCN1A, and that was maybe 10, 15 years ago. And now we have thousands. And I used to kind of say, well, if they have an epileptic encephalopathy, if their onset was under 2, if they're refractory, all these ifs, that you had to meet some sort of criteria to get genetic testing. And I think as I've come through that, and as things have gotten more prominent and easier to obtain, and as I've gotten more and more results and seen more patients, I've pretty much decided that almost everyone with epilepsy should have genetic testing. And there shouldn't be very many of these ifs. I've had patients where, you didn't expect a positive result, and it was something that changed their treatment. And so I truly think that everyone with epilepsy, I think the only caveat might be still if you have an explanation for why that person has seizures. If they had a brain injury and then they developed epilepsy a year later, I don't know that we're going to get a high yield for that. Or if they were a child and they clearly have an in utero stroke, hemiparesis, all these kinds of things, I think that is kind of less. But if you don't have any of those explanations, clear acquired epilepsies, then I think genetic testing is very important. There are tests that are available free of charge. So there's a number of companies that have partnered together to offer genetic testing to children with epilepsy under the age of 8. So we utilize that program a fair amount in our institution. There are labs that have payment plans that can be used to offset some of the cost, or even they may even take families on and advocate on their behalf to have insurance testing. There are many companies and programs that offer free genetic testing on a research basis to participate in research programs. And I think that many organizations who partner on behalf of genetic diagnoses are trying to advocate for easier access and more equitable access for genetic testing for people with epilepsy. And I think it's up to us as physicians to kind of prove that it results in better care, changes in care, less cost over time to do these tests to begin with. And there certainly is a growing body of literature that says that.